Hi, everybody. This is Kit Kramer with the Asheville Chamber. At our conversation yesterday about vaccinations and mask wearing and all the steps we can take to try and control our future, our collective future, there was a whole lot of interest in the slides that Dr. Bill Hathway was sharing. I'd like to have Dr. Hathway go through those slides and give you the context for the information. Many people were interested in having those, so we really appreciate him coming back today to do that with us. He is the Chief Medical Officer for the North Carolina Division of HCA. So Bill, thank you for joining us, and please take it away.
Thanks, Kit. I appreciate the opportunity to do this and appreciate everyone taking time to watch this presentation. I am going to take a minute here to get the presentation shared, and then we will go ahead and get started. So Kit, tell me if you're seeing the full slides on my screen here.
I am seeing them.
All right, fantastic. Then we'll go ahead and get started. Again, it's a privilege and an honor and a pleasure to be able to be here as we find ourselves in the midst of circumstances none of us probably ever believed really could happen. We'd heard about predictions of the possibility of global pandemics, but even those of us in healthcare didn't think it could affect us in the way that it has. And now we're well over a year, almost 20 months into the pandemic, and we find ourselves in the midst of another surge. So I wanted to spend today talking to people about where we are, what the numbers look like, what's all this about the Delta variant, talk a little bit about vaccines and the need for continued vaccination of everybody in our community, and then to wrap up with a little bit of a prediction of what the future might hold. I don't know about you all, but I've found myself up far too late every night getting roped into Olympic sports, some of which I didn't even realize were Olympic sports, such as skateboarding, which I actually watched the other day. But this cartoon struck me as kind of an appropriate blend of both what we're experiencing with the pandemic and what we're experiencing with the Olympics. And the caption, as it reads, is "Nothing like Olympic athletes to remind us all that a year of sporadic Zoom workouts ain't quite the achievement we thought it was." All right, enough of the humor. Let's look at the numbers here. World cases are rising. This is data from earlier this week. This is the curve from the beginning of the pandemic back in 2020. You can see that we had a nice decline since a peak in April worldwide, but now we've seen a 16% increase. That increase is even more prominent when you look at the United States cases. We've had a 139% increase over the last 14 days. We've now hit the stunningly, almost impossible to have conceived number of 35 million US cases and 600,000 US deaths, which over the last 2 weeks is a 49% increase. Note the slope of this curve is steep and the rapid rise, and note that it's still going up. Cases going up, deaths going up. We're into something that we need to get on top of right away. Transmission across the United States is high. If you look at the legend at the bottom, you'll see red means high transmission, orange substantial, blue low. Almost the entire United States has areas of is in an area of high transmission. In areas where vaccine rates are high, the Northeast, some of the upper Midwest, you'll see that there's a little bit less transmission, although it remains high because we still have many, many, many people who have yet to be vaccinated. This translates into this hotspot map, and you can see through Missouri, Arkansas, Louisiana, the lower South on the Gulf Coast, almost the entire state of Florida. I heard that 1 in every 5 new cases is occurring in the state of Florida right now. We're seeing hotspots, darker colors, more per capita cases of COVID being diagnosed. Even the state of North Carolina, we had been in aberrancy in the past, and that our little 18-county region was a little bit protected, was more of a lighter orange color than dark as it is now, but now we're heating up here locally, as you'll see as we move forward. This is the North Carolina data again, and for those of you who aren't familiar with my slides, I put the website or reference information at the bottom if you want to go find this yourself. This is data. I find the New York Times is a very nice way of displaying the data. It's all data that's available either through the CDC or through Johns Hopkins University, which has a great website that compiles it. But I've taken many of these graphics from the New York Times. You'll see in North Carolina, we're up 192% over the last 2 weeks, and that number has been significant. The deaths, while small overall, are rising again. And we had gone for almost a month, as you'll see in a little bit, in Western North Carolina without a death, and now we've had more deaths. And we've, again, crested 1 million cases and pushing 13 to 4, almost 14,000 deaths. Not a good thing. These are mothers and fathers and grandparents and brothers and sisters who are dying. And what's most tragic is the deaths are occurring in younger people now as the pandemic progresses. Two graphs here, or two charts here, that show the per capita cases. This is what I was referring to earlier. We used to be a lighter orange. We had fewer cases per capita than the rest of the state. We still do sort of in aggregate as a group, but that color it's homogenizing. We are becoming more like the rest of the state as time goes on, and calls out the need for masking and vaccinations. Our vaccination rates in Buncombe County high in the age group above 65, with over 76% having had vaccinations, but not high enough in the rest of the population. We'd like to see this much higher. And Buncombe is higher than the rest of Western North Carolina. So we have a lot of opportunity to improve our vaccination rates throughout our 18-county region. So what's going on? So we have this new Delta variant. And what is a variant? I'll tell you about that in a little bit. But the Delta variant is a modification of the original strain of SARS-CoV-2 that infected people. And what this graph does, this chart, it compares the level of contagiousness and severity of illness, how many people the virus kills on average, to other types of viruses. On this axis on the bottom, the x-axis, as you move to the right, that means the virus is much more easily transmitted. Measles is one of the most contagious illnesses that we know of, as you can see here. And then over here, as you go up the graph on the y-axis, it's a logarithmic scale of fatality, with Ebola, MERS, SARS, bird flu being very, very, very mortal, high case fatality rates, but not quite as easily spread. And then here's the old Delta variant. We don't have a point estimate because we're learning about it, so we have a box, but it looks like it might be as spreadable as chickenpox, and it's certainly much more fatal than the regular flu, polio, other illnesses here. So this is a real problem, and I think, and most of us in the scientific world think, that this is this increased contagiousness of this variant is in part contributing to the spike that we're seeing now. This is data at Mission Hospital. The numbers aren't accurate right now. It's a few days old. We've actually bumped up to 60 plus patients in-house at Mission. The blue line is our data of all positive patients. The numbers aren't exactly right. You'll see the scale over here. This includes patients who are admitted and who are discharged, not the numbers who are in at a given time. But on our snapshot this morning, we over 60 patients. Nowhere near where we were in January. That's reassuring, but nowhere near where we were on July 4th when we had 8 patients in the hospital. And so it's important that we do something as a community, that we respond to this as best we can to decrease the spread. And we'll talk about that in a minute. I mentioned that it's a mortal illness on the graph I showed you. We know that there's a 1 to 2% fatality rate with COVID, higher in older people, where it can be as high as 20% mortality in people above the age of 80, and with other illnesses. This demonstrates the excess number of deaths that have occurred since the beginning of the pandemic. If you look at the data, the number of deaths per week in the United States is plotted. And believe it or not, there's a rhythmic or cyclical pattern to this, increasing in the winter time when we have increases in flu-like illnesses and respiratory illnesses. When we hit January of 2020, we had a spike that came in May as COVID came to the United States. And the blue numbers and red dots are the number of excess deaths, which we believe are attributable to COVID-19. And I share this with you. You know, it's a number, right? These are statistics. And I don't want this to be lost and left simply as statistics. Each one of these deaths, as I said earlier, is a person who had a family, who had loved ones who cared for him or her, who was a contributor to our community, and who now has passed away, perhaps unnecessarily. And this is really to call on us to do what we can to help stop the spread. We have done a very good job of tapering the number of deaths that have occurred. This is a representation of the deaths that have occurred within our health system at Mission over time. They've a cumulative total number of about 340 deaths to date. The slope of this curve represents how many deaths per day. This is back in January and February, December, the post-holiday phase. The steepness means that many people were dying every day, and the closeness together, the lack of space, indicates that people were dying each and every day. Shift out here, we began our vaccines, the curve flattened. Remember how we said we wanted to flatten the curve before? This is the graphic example of flattening that curve. In the increased space, the width here means we went many days without a death, almost a month without a death here. And now with this recent surge, we're seeing deaths. Remember, cases come first, followed by hospitalizations, followed by deaths. So I fully expect, I hope we don't get as dense and as steep as we were back here because we vaccinated the elderly, but I do expect to see more deaths. So what's this all about? This is really an issue of two things. One is a new variant that we've alluded to being more contagious than the prior variant. And number two is the fact that our vaccine penetration rates in our community aren't where we need them to be to prevent spread of the illness. And then perhaps number three, I'll throw in there right now, the fact that we're not doing what we need to do in terms of attentiveness to social distancing and masking to protect people who are most vulnerable. What's a variant? This is my analogy that I think is pretty simple. Variants are different viruses that have it's the same virus that has a different RNA sequence. RNA is the genetic code that tells the virus what it's going to be. It's how we produce our proteins. And when you have a different variant, it can change the antigenicity, meaning how well our immune system responds to it, how well our vaccines are capable of fighting it off. It can change how sick it makes us, and it can change how easily it's spread. Those are the three big things we worry about variants. Can we fight it off? How sick will it make us? And how easy is it spread? And I liken it to the analogy I have with these Labrador Retriever puppies. If SARS-CoV-2 is the virus, that's what dogs are, and you have a specific type of virus, SARS-CoV-2, you can have variants. These are all labs, but they have slightly different shapes. And that's sort of like what happens with the virus and its mutations. Right now, the dominant variant in the United States and all across North Carolina for sure is this Delta variant, comprising over 92% of the cases. That's this big orange bar. This is data from the CDC, and you can see that since June, it's just taken off like wildfire. And again, that's because it is so easily transmitted. And now it comprises the dominant strain across the United States and certainly in North Carolina. This is a little bit scientific. If you'll bear with me, I'll walk you through why the Delta variant matters. It has changed this spike protein, which makes it more able to survive in our nasal passages. And that means there's an increased viral load, more virus in the passageway, which means it's more easily transmissible. And what we've learned is that even being vaccinated, there are a small percentage of people who can become infected despite vaccination. Now, the good news is, And I'll emphasize this in a minute. The good news is that if you're vaccinated, your likelihood of severe illness or hospitalization is dramatically reduced. So while the vaccines aren't 100% effective at stopping this, they're very, 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 did I say very? Very effective at decreasing the severity of illness and death. And so that's really, really important. Now, one of the problems is that with this increased transmissibility, we have this fancy number called an R naught. And that means how many people can one person transmit the virus to? With measles, you saw it was 15. It could be as high as 9 people that one person can infect with this new variant. And that means that we have to have a higher level of herd immunity, more people vaccinated or immune from natural infection before we can be protected. I'm going to skip this scientific slide, but this is the spike protein, just so you can see. And this is the cell surface where that protein attaches. And it looks like it's more able to attach to the cell receptor and then live in the nasal passageways with partial shielding from the immune response. All right, so we talked about the numbers. We talked about the Delta variant, which is bearing down on us right now. The next thing we need to look at is a vaccine update. Vaccine trends are listed on the left here. We had tremendous demand for vaccines starting in December. I know the numbers are small here, but this is December 13th, and these are the daily vaccinations across the United States. And we crested in April between first and second doses at over 4 million being administered on a given day. It then had a substantial and significant decline over time. We had vaccinated about 50% of the population in North Carolina at this point in time. 58% are partially vaccinated. And with this recent worry and uptick in Delta, the Delta variant, we are seeing an increase in demand for vaccines, which is good. But again, we have many, many people who are unvaccinated. And as I said, we want to get at a minimum 75% of the population vaccinated, but preferably, 100% in my opinion, but we need at least 85 to 90% for that herd immunity. We're doing better with older people than we are with younger. Remember, the vaccine's not approved for people under the age of 12 yet. We hope that the 5 to 12 age group will get approval very, very soon. But we're about 58% if you look at everybody over the age of 12. 60% if you limit it to 18 in the very old, or forgive me for those who are just 65, but in the oldest population segment that we're looking at, 80% are vaccinated, which is great news because of course they're most susceptible to infection. So good news that we got the elderly. Unfortunately, we don't have the main age group, and it's this population of people, the younger now, that are being infected and being hospitalized. We've seen a substantial increase in the number of people between 20 and 65 who are hospitalized. This is, that was state data on the prior graph. I'm sorry, national data on the prior graph. This is state data and just a graphic representation to show, again, by age group, the full vaccinations versus partial vaccinations and how this gets much better over older age groups. So good news for the older folks. When you look at all of North Carolina by vaccination rates by county, we've done a pretty good job out here in the West. We're doing reasonably well, but we have some pockets of isolation where we really need to push up our vaccination rate. We're doing well compared to the rest of the state, but we need 70, 80, 90%. And so in order to get that, we've got to get that last push done to get the vaccinations where they need to be for herd immunity. Interesting data here, and it's a complicated slide, and I'll walk you through it slowly, but the gist of it is this was a survey done by the CDC where they looked at 13,000 people across the country and tried to figure out what is their intent. Do they plan to get vaccinated or not? And the summary results are presented in the left here. 70.5% are vaccinated or definitely plan to get vaccinated. 11.4% are unsure. This is the group we really want to work on to get vaccinated. And then 18% probably or definitely would not. And again, the colors here are put into the chart over here. So if you look to see which groups are least likely to get vaccinated, they'll have this peach or orange color. I'm sorry, I'm colorblind, but this lighter color, and you'll see it's younger people, rural more than urban or suburban, and people who are in lower income brackets or uninsured are far more likely not to get vaccinated, at least based on this. And this is data across the entire United States. Similarly, the subset that we looked at in North Carolina, the same thing, we're less likely to get vaccinated overall. Remember, the prior slide said 70%, and we were at 11% here in 18. We have many more shifted who are unsure or probably will not get vaccinated. Again, similarly, younger, little bit poorer, and the rural and urban folks, which difference that we need to look at. And what's Western North Carolina? We're older, we're more rural, we have problems with poverty. So 2 of the 3 against us on getting people vaccinated. I talked about this earlier. While we see that people can be infected even if they're vaccinated, it is an 8-fold reduction. So you're 8 times less likely to get infected if you've been vaccinated. Critical piece of information, 8-fold reduction in the rate of infections for vaccinations. So people should not be telling themselves, well, I might get infected anyway, why should I get the vaccine? You absolutely should, because even if you do get infected, your likelihood of being hospitalized is cut 25 times, and your likelihood of death is reduced 25 times. So it's critical that even though we don't have vaccines that are specific for this variant to shut it off completely, the vaccines that we have do work, and we must get people vaccinated to keep them healthy, not infected in the first place, and if infected, not hospitalized or dying from the virus. Really, really important that we get that message out. Good news is the FDA looks like it will be giving approval to the Pfizer vaccine for full authorization. If you recall, right now our vaccines are under what we call emergency use authorization, which meant that back in December, over a year ago, or December of last year, that we took the weight of the evidence and decided that what we had justified using the vaccine in this emergency situation, even though it wasn't what the FDA would have typically done. And I think that was absolutely the right decision. We've administered billions of doses on the planet, 350 million doses in the United States, hundreds of thousands of millions of doses in North Carolina, and the vaccine is safe and effective. It has very, very, very few side effects. And to me, it's just a technical issue that we're waiting for final approval for the final, what we call BLA, or Biologic License Application approval, which we expect for Pfizer next month. And then we hope will come shortly thereafter for Moderna. Their application was submitted a little bit later. And then once we get that, I think that really should reassure those who are skeptics and will open the door for possible mandates for vaccination in schools and other places. So what does the future hold? My crystal ball is a little bit cloudy, but I did whip it out and try to see if I could get some information so we can predict what's going to happen with this curve. This is data from the West Coast. There's a group out there, the IHME, that has been making projections since the beginning of the pandemic. This data is where we've been. This is our point in time right now as we're in early August. And there are 3 projection curves listed here. It looks, if we go the way we are, that we could continue to peak into mid or early September. That's the current projection. If we are wrong and things get worse, it could even be as high as the beginning of October with continued rising cases until October. I want to emphasize that. That's a possibility. Interestingly, and this really calls on why masks are so critical, the use of masks in public spaces dramatically reduces the transmission and effectively stops the transmission as soon as you wear the mask. With vaccines, it takes 2 weeks. to start to build immunity. We require a second dose, takes another 2 weeks. Vaccines are not the immediate answer to this, although they're critically important. Vaccines, in my opinion, are the left hand, masks are the right hand. We have to put both together as we take on this really huge threat to our community, to our Western North Carolina region, to our friends and family, and to the state and globe. There is potential hope. I think there is some potential hope that we may see a drop sooner than later, but I'm not banking on this. This is data of new cases per day in the United Kingdom. And over the last 14 days, they have seen a drop in their cases, although it's flattening out. And they, similar to us, have been 90% Delta variant, and they're about 57% community full vaccination. So we'll watch this closely. We don't really understand the science by this, but we'll watch this closely. All right, that's a lot that I went through. Let's just put it together. And then, Kit, if you have some questions, I'd be happy to take them. Bottom line, Delta variant, more contagious, potentially more severe. We think this surge is likely to cause problems globally in numbers that exceeded what we saw in January and February of this year in the United States. While vaccinated individuals can be infected, their severity of illness is lower if they've been vaccinated. But this was the reason why the CDC called for universal masking indoors, and why we think it's really, really important that we mask. Even though you don't have a severe illness, you can spread it. We must stop the transmission. Masking works, is highly effective, painfully underutilized. I think I've said that about 1,000 times. I hope you've heard me. Let's get the mask back on. We'll get FDA BLA approval for Pfizer soon and Moderna to follow. And I didn't touch on boosters, but I think there's a good chance we may need boosters later down the line. That's a topic for another discussion. All right, Kit, anything you have to ask or anything I can add?
Yeah, what's the word on Johnson & Johnson in terms of when that could potentially receive official approval?
I haven't seen that yet. I don't think they have submitted their data for full BLA approval yet. And this is, while it's on an accelerated time frame, there's no set pattern by which the FDA says, if you submit now, we'll let you know in 90 days. So we're waiting actively to hear that.
I heard that Stacey Saunders was talking about how the Delta variant spreads much more rapidly than the original virus spread. And I was looking at your R0 figure where you were talking about, she was talking about it being a spread of 6. You're seeing 9?
Well, my 9, if you remember on that graph, there was a large box indicating we don't know exactly where it is. It could be as bad as 9. It could be as low as 6. It's certainly higher than the 2 to 4 that the Alpha variant was. So I think qualitatively it's worse. Quantitatively, we don't know exactly how worse. It's just more transmissible.
So we can somewhat control, we can influence our future by getting vaccinated, encouraging those we love to get vaccinated, and by wearing masks when we're in group settings.
Absolutely. Indoors in group settings, or close when you're outdoors in a group setting. I know that that's not what people want to hear. I know that we're all sick of wearing masks and that the time has come to get past this, but we've shown with this recent surge that we're not past this. No, and so I think, just like we've made sacrifices in this country when we've been under other very difficult circumstances collectively for the good of the country. I keep thinking about the World War II analogy where some made the ultimate sacrifice going overseas and fighting, but everyone on the home front gave up something because that was the challenge. If what we have to do is mask, that's a very, very small sacrifice to get through this. And it's a very, very small sacrifice to save a life. And we will save many lives by doing so, by stopping that chain of transmission. And of course, vaccinations are key. I mean, I can't emphasize enough. They are safe, they are effective. They will help you, even if you do get sick, survive the illness, but most importantly, they'll decrease your likelihood of getting sick. and that will allow us as a community to get back to where we all want to be, which is the new normal.
Right. Well, a mask is better than a shutdown for sure. And I know that people are also frustrated at the thought of that, but we can influence the outcome by our own behaviors. So, Bill, thank you so much for your time today and for the great data. We really appreciate it. And I want to encourage everybody to continue offering incentives if you can to try and encourage vaccination as much as possible, and also wear your mask. It's a pretty simple thing to do. It's something we know how to do. We know what the COVID protocols are. So let's control what we can control and take that little bit of control for our community, for one another. Thanks very much for your time. And thanks again, Bill. Appreciate you.
Thank you, Kit.